All right, I will be presenting on agoraphobia. My client's name is Bradley Anderson. Bradley Anderson, that is Bradlyanderson. He is 35 years of age. My name is Dr. Matt Aida. That's Mattaita. We came up with two differential diagnoses for Mr. Anderson. That's going to be agoraphobia and specific phobia. We ended up ruling out specific phobia because we find that his fear and anxiety don't stem from a specific event. There are going to be 8 diagnostic features for agoraphobia. The first one is going to be the client experiences obvious fear or anxieties about at least 2 of the following. Being outside of the home alone, being outside of the home alone, being in open spaces or enclosed spaces, being in open spaces or enclosed spaces, being in a crowd or standing in line, and the use of public transportation. The second criteria is the client's concern about lack of availability of help if panic symptoms occur, resulting in fear or avoidance of these situations. Once again, that's the client's concern about lack of availability of help if panic symptoms occur, resulting in fear or avoidance of these situations. The third one is going to be when faced with these situations, fear or anxiety almost always occurs. When faced with these situations, fear or anxiety almost always occurs. Fourth one, when faced with these situations, it is either avoided, requires the presence of a companion, or endured with intense anxiety. When faced with these situations, it is either avoided, required of the presence of a companion, or endured with intense anxiety. The fifth one, when faced with these situations, the amount of fear or anxiety is disproportionate to the actual fear proposed by the anxiety-provoked situation. When faced with these situations, the amount of fear or anxiety is disproportionate to the actual danger posed by the anxiety-provoking situation. The sixth one, duration of fear, anxiety, or avoidance is at least 6 months. Duration of fear, anxiety, or avoidance is at least 6 months. Number 7, the client experiences notable distress or impatience in functioning as a result of the fear, anxiety, or avoidance behavior. Again, that's the client experiences notable distress or impairment in functioning as a result of the fear, anxiety, or avoidance behavior. And the last one, number 8, the client's symptoms are not due to another mental disorder. The client's symptoms are not due to a mental disorder. So as far as Bradley's stories go, we find that he's been seeking help for many years. He first finds that these symptoms occurred when his family's finances were poor, and he recalls a time when his family car was repossessed and they were forced to take a bus. The first time he took a bus, he had, what would be a panic attack. His heart began to race, and he had a hard time catching his breath. He thought he was dying. He does admit that he was glad that his sister was on the bus because if he was going to die, he wanted to die with a family member, more or less. Over the years, his fears grew. After graduating college, he was hired into an entry-level management position that required him to move to a new city. This new position required him to cross over a bridge over a major body of water. Initially, that bridge was not a big deal. He crossed it daily, but as time went on, he noticed that his symptoms that he experienced on the bus were coming back. It became so unbearable that even though with the car crossing, of course, that he moved his apartment to eliminate crossing this bridge entirely. Even if it meant losing the deposit from his first apartment. Then he began developing new fears. He developed a fear of being shut inside airplanes and elevators. He also noticed that each new fear cropped up, he grew more and more dependent on his family and friends for support when he was anxious. His fears continued to the point where he could no longer leave home without having someone with him, very dependent on someone, and he had to take an absence from his job and is currently living on disability. He's dependent on his family to help him to go to the bank and grocery shop. So, very dependent on his family. Next, I'm going to cover the multi-axial diagnosis for Bradley. Axis number 1 is agoraphobia. Axis number 2, none. Axis number 3, none. Axis number 4 is the transportation. And axis number 5, we have chosen 45, the score of 45. I'll now go over the theoretical perspectives. For the behavioral perspective, we've chosen this client's symptoms may be due to a faulty learning experience. His first year anxiety response may have resulted from classical conditioning, where the client made a stimulus response association between riding the bus and his bodily symptoms of heart racing and difficulty catching his breath. The client then experienced such conditions. Each time the client avoids riding the bus and crossing a bridge, he is negatively reinforced. From the biological perspective, this client may be experiencing these symptoms due to an overaction of the sympathetic nervous system. He may also have a deficient of GABA or an excessive norepinephrine. For the cognitive perspective, the client's symptoms are showing a misinterpretation of danger in which he perceives danger when there is no such danger. His fears are based off of arbitrary inferences of public transportation, enclosed spaces, and now leaving his house, in which his fears are based off of no evidence or past experience that would cause such fears. The client is experiencing apparent conditioning in which he is using avoidance behavior or avoid situations that give him panic or anxiety. That is all.